forward. I think we're in a good space, and I know that you all are feeling a little time pressed, but I think with good leadership help from Dr. Hannah and Pierre, we're going to do great. So I'm calling the meeting to order now, and Mary Claire will call roll.
Just say present if you are here, and remember if you are virtual to mute your screen after you have spoken. Dr. Yolanda Barner.
Here.
Senator Hobb Brown. Senator Nicole Boyd.
Here.
Dr. Susan Buttress. Here. Representative Sam Creekmore.
Here.
Miss Randy Carter.
Here.
Dr. Daniel Edney. Dr. Tanya Fitz.
Here.
Dr. Heather Hanna.
Here.
Miss Biz Harris. Dr. Ashton Hotard.
Present.
Miss Leslie Junkin. Representative Kent McCarty. Representative Carl Oliver. Senator David Parker. Dr. Denise Powell.
Here.
Representative Rob Robertson. Senator Robin Robinson. Ms. Tracy Buchanan.
Here.
Dr. Casey Stratton Gackey.
Here.
Ms. Candace Taylor. Dr. Courtney Walker. Dr. Tricia Wilson.
Here.
Did I miss anyone that is a member of the task force that is present? We do have
I'm here, Sarah Myers.
Oh, Sarah, I have not announced the advisors yet, but thank you.
Perfect. Sorry.
We do have a quorum, and I will announce the advisors now. Mr. Mitch Adcock.
Here.
Dr. Kanisha Bennett.
Here.
Dr. LaShondia Carson. Dr. Candace Carter Stevens. Dr. Katie Cassidy. Miss Georgia Graham.
Here.
Miss Sarah Myers is here. Dr. Julie Parker.
Here.
And Dr. Kenya Wolf.
Here.
And then we also, with us today from the health department, we have Dr. Witt, Dr. Brooks, Ashley Wolf, and Chris Adcock. Thank you all. Oh, and Bob Williams is with us from insurance. Sorry, I missed that.
Well, again, thank you everyone for being here. And I know there have been several pre-meetings prior to this one, so thank you for your time on that. Before we get to the next step, I do want, I hope everyone received the minutes, and I'd like a motion and a second for approval of the minutes. Senator Robinson moved. Is there a second?
I second. Yolanda Barner.
Dr. Barnard has seconded. Okay, thank you. So the minutes are approved. So next, for the next 30 minutes or so, we'll be talking about the chart that was created to help assist with report writing. And I think most of you hopefully have seen this. And as we move along, we want each work group to discuss the pieces of the chart. So Dr. Hannah is the one who had the vision for moving forward, and before we go further, I do want to thank Mitch Adcock for spending a lot of time helping along with looking at all this. So Mitch, I want to thank you too for this. So Dr. Hannah, why don't you take the lead here? You and Mary Claire have it for the next 30 minutes.
Okay, sounds good. Thank you. And I don't know if I want to be credited with the vision of this monstrosity or not. That may not win me any friends, but we had, Mary Claire had originally thought that the best course of action would be for us to each create a report from our different work groups. And then as we went along in our own work group, the design work group, we realized all of this overlaps so much that it probably made sense to try and combine it into a single report and have the different work groups contribute to different parts of that. So this is an attempt to synthesize it all into something unified. And so what we're really looking at for the final report is two pieces. Number one is this chart that we've all been working so hard to compile. And the other is a final report outline that Mary Claire has pulled together, and she's going to go over that with y'all. But we will use the content of this chart to then fill out our respective sections of the final report outline. So I just want to say a big thank you to our work group. We had full day meetings, and I wanted to really have more feedback loops in the process with the full group, but we, as Dr. Buttress mentioned, time has been short. But we generated so much great content for the final report. So, I'm going to go through this chart. I will say that this is still in draft form, and we're not going to be able to go over each cell and discuss the content today. That would eat up our whole meeting and we would all be asleep. But what I do ask is if we can all really take a close look at this after this meeting today and let Mary Claire know if there's something on here that you don't understand, have a question about, or disagree with, now's the time to get that feedback in so that we can resolve that before we start, moving into actually writing it up. So I think most of you are very familiar with most of the content we've been talking about. I think a lot of the same ideas have bubbled up numerous times. But if you could just look and see what has landed in this chart, because these are our recommendations moving forward. So what you have in this chart is an attempt to connect all of the discussion that we have had and all the recommendations that have bubbled up from those discussions to connect them to this first column where we have the issues that were identified in our original report. Year one of this task force was really honing in on what we wanted to see addressed. And so here are the issues that were identified in that first column. In the second column, what we have is this idea of a hybrid delivery model that we have conceptualized together, how it is going to address each one of these generally, how it speaks to them. Then we're going to have a column where, if willing, the Department of Health will have an opportunity to talk about the different changes that they have already put in place, because they're already seeing really good results from initial changes that have been made internally. So this is their chance to share those in this final report document. And then we have our recommendations that speak to each one of the issues that were identified for first steps. And here is all the content that has been generated for that. Lots of good stuff. And you see different colors, and the different colors are the different groups who have contributed. The black is the design group. And I'm going to go, I have a cheat sheet over here. And then purple is the billing group. Orange is the quality control group, and green is the training group. And I know as people were adding this in, what we found is there was so many of the recommendations were the same across the groups. And so each work group just added in new content in a different color. And here's an opportunity, if this is something, if the recommendation is something that's going to be phased in over time, we have an opportunity to outline that here. And then I know Anna Lynn and folks at the Department of Health are working on cost estimates. And ideally, we can connect those to the recommendations that are being made. And there's an opportunity to say, okay, in order to do this, this is what it's going to cost the Department of Health. And then likewise, we have recommendations and implications for hubs as well. And so this column outlines what the expectations of the hubs are moving forward and the implications for them of this new model. Again, we have an opportunity to say when particular changes might be phased in and what those changes might cost. And so hopefully these cost estimates will inform recommendations to the legislature. And so we want to really spell out here, what are we asking the legislature for in relation to these different recommendations that we're putting forth? So what do we want to see from them? Is it a funding ask? Is it more than that? What do we want to see? I know there have been some recommendations that pertain to the state interagency coordinating council, SIC. And so we might have some ask of the legislature around that. And then you're going to see in this final column in the outline that Mary Claire goes over with us for the final report outline, this is the section that this content will go into. And so again, she will review that with us. So I'm going to pause there and ask, what questions do you have about this chart or concerns? Questions, concerns, any comments? Does it make sense?
I see some head nods. Heather, I know the question came up about will this, and I know we can talk about this later, will this chart be what we submit to the legislature? Will there be pros also in between? Do you want to comment on that?
Yes. So the idea is this chart is way too unwieldy to put in, it's not going to fit on a single sheet of paper. But what we're thinking is we'll break it apart. And for the section in the final report that pertains to that chart, we can put a piece of the chart in with each of those sections. And I think that'll be a little bit clearer when Mary Claire goes over the final report outline. Does that answer, Susan, your question?
Yes, thank you.
Okay. Any other questions, concerns, comments? If not, I will turn it over to the different groups and check in with you to see if there's anything you'd like to say about your content in the chart. Does the billing group, is there anything you'd like to discuss related to the chart?
So I will fully admit that I did not have looked at it since it came in the middle of the clinic today, but the billing group has worked hard to come up with high-level recommendations to changes in current billing practices and looking at the areas that the hub model will need support, excuse me, need support. And if you guys have any questions about that, I'll answer them if as best I can.
Okay, I am going to share this so we can look over. I feel like we've discussed as far as the design that we're moving to. I feel like we have had discussions about that with the whole group, but in terms of the recommendations that are being made, Dr. Fitz, is there anything that you would want to highlight as general strategy?
For general strategy, we want to move the billing coding for the MSDH to work with the Division of Medicaid and other private payers to come up with some codes that would cover and possibly open up codes that would cover what EI services do, including making home-based services billable, but not only that, also improve the prior authorization process by developing a potential modifier that would indicate to our payers that this child has already had a full and thorough workup and is going to get a full and thorough workup every 6 months, to limit the and streamline the prior authorization process, and then maximize outside funding sources and not build to the health department initially as the payer of last resort until they have billed their other insurances first. And then also provide services for the agencies that have not traditionally been medical providers and are going to have trouble in the credentialing process, as well as the billing and the documentation process. And then um, and then they should have some budget over how they're going to do that.
Mhm. Great. Thank you, Dr. Fitz. You sound like you're not feeling well, so I appreciate you talking. Okay, what about Dr. Parker?
Heather,
Yeah.
if it's okay, may I add just a couple of things on the billing?
Please.
And you may have said this, Dr. Fitz, I was having a little trouble understanding everything. So I apologize if I'm repeating, but some big issues that we need to make sure that are highlighted, and I think they're in here, as I read through, is potential of bundling, making sure children who have private insurance also have coverage, making sure that as far as billing doesn't happen unless providers are credentialed quickly, and that all gets through. It's credentialing is one thing and contracting is another, which is a big discussion that we have had over and over again. And so we want to include something about streamlining credentialing and contracting, because if we don't, we'll continue to have the same problem, that it can take 6 months to get somebody able to bill, whether or not the codes are billable or not. And then the other issue that we need to make sure as we are addressing all this is the services in the natural environment are billable. That's a huge issue, because that, our goal is to have 100% of kids served in the natural environment, knowing that that won't happen likely, but we want to get as close to that as we can.
Thank you. And two, I mean, I think that brings up a good point. That I do think it's important for each of us. Dr. Buttress, as you read over this, don't feel like just because I'm not in the billing work group that I can't add content to this. If you see something that's, burning on your mind, add it. And then Mary Claire will make sure sorry, Mary Claire, to volunteer you, that, that, you know, it gets worked out with the billing group, that it gets incorporated or not, or discussions can be had, but we want to make sure that everybody feels like they have the power to go in and make comments and add content to any section, because that's how we're going to get all that great, you know, synthesizing of thought. Great. Okay. So, Dr. Parker, I don't think Dr. Walker is here today. Is there anything regarding training? We were just talking about credentialing that you would like to speak to?
So thank you, Dr. Hannah. So we did add some information to the document. Mary Claire, I appreciate you adding that late yesterday evening. I was in class until after 5 yesterday. Our discussions in our group are really focused on several things that we know that our state office has really worked hard to go ahead and implement, things like more training for professionals who are currently in our system, and then opportunities for very specific competency onboarding. And so we're very appreciative of their intentionality about that. Another component to our conversation was really looking at what the federal law says about early intervention being a system of services. And so because it is a system of services, you know, the competency training doesn't have to rest specifically just with our Part C program. And there's been a history in our state that there has been cross-disciplinary competency trainings for many years. We haven't seen that in the most recent years. And so that's definitely something that we're recommending, is that there be opportunities for our state office to either look at exploring training grants or doing, as has been done previously, doing some more collaboration with other early childhood systems in our state to really provide that kind of competency training that we need, not only for health-related disciplines, but the early childhood industry as well too. And so we have provided some opportunities to think about what that could look like from the lens of the Part C program, but then also partnering with those programs throughout the state who could really make that competency training be very sustainable as we move forward.
Great. Thank you so much. All right. And what about our quality group? Is there anything that you guys would like to say about the content that you've added to the chart that you'd want us to know?
Hi there. A lot of it overlapped with other groups. This is Denise Powell. I think I heard Dr. Buttress talk about, streamlining the credentialing and contracting, which was one of our many conversations, and there's actually a running email to clarify further on that as well. Some of the other add-ons we had to already existing statements, improved referral process, making a running list of the hub hybrid systems throughout the state, so that we can start just, knowing what exists and what we need to add on throughout the state. The services in the natural environments, I believe Dr. Buttress commented on that as well, and just recommended virtual services, really adding on to that to help with screening assessments in which the teams could go mobile and assess children in their natural environments to take some of that burden off of providers and hopefully decrease the burnout rate. And then we went to service provider gaps and talked about changing the state policy and personal board rules to be more inclusive. And so that way we can open up the positioning so that it doesn't necessarily always require a special license. So a lot of overlap, but just really doing a lot of confirming and supporting other task force groups.
Great. Thank you, Dr. Powell. Okay. So listening to some of these recommendations, does anyone at the Department of Health, you may not have had a chance to look this over carefully, but just based on what's been said and any initial takes you've had to look at this, is there any way that we can make this improve on this? Do you see any points that we need to consider before we move forward?
It's in Linwit, and we have reviewed this and have had internal discussions. Nothing to add at this time. We
Great.
just appreciate being involved.
Wonderful. Thank you. We appreciate you guys and all the great work that you've already done and are excited about highlighting that as a part of this. So, okay, any other thoughts about the chart before we move on to the final report outline? Okay. I'm going to pull that up and share it with you. Okay, so Mary Claire, I'm going to take your cue in terms of scrolling through this.
Thank you, Dr. Hannah. I hope everyone received this this morning. I'm sorry that we didn't get it to you before today. We were working on it until the very last minute yesterday with the chairs and lead advisors and Dr. Butcher. So we appreciate your patience as we got this together. And thanks again, Dr. Hannah, for sharing your screen and for going through the chart. She did not know she was going to have to do that for us until yesterday afternoon. So I really appreciate her taking the lead on that for me. So I will go through the outline. If you have any changes or suggestions, just let us know. And I think Dr. Hannah should be able to make notes in the document as we go. For this report, the chairs, the lead advisors, and Dr. Butchers have discussed having a more condensed report and just referring legislators and other stakeholders to the previous report for more detail about the program and issues, and just focusing this on the recommendations and how to best help health implement and improve the program, and then provide specific recommendations to the legislature. The group responsible for writing each section in this outline is in parentheses and highlighted in yellow. Drafts from each group are due by October 15th, but I would be happy to have them before then. I know it is a tight deadline, but please, any information you can send me before then, I'd be happy to take. I will then combine the drafts from each group into one report. I will try to identify any questions, information that's missing, ensure consistency, try to remove any duplication. I will send this out to the chairs and lead advisors and anyone that's been helping write the report for review so they can review the complete draft. And then I will send it out to the full task force and the Department of Health before October 29th. I hope to have it to you a week before October 29th because that's when we plan to have our meeting. But as you know, things go, I may not have it by then, but that is the hope. Because after you have reviewed the report, if you have any major changes that need to be addressed, I would like you to send those to me ahead of time. And when I say major changes, I mean things like wrong or misleading or confusing that has to do with the content. I don't mean you don't have to worry about commas or capitalization or anything like that. We have an editor on staff and several people that will look at this report before it's published. But any major issues we'd like to address beforehand, before the meeting on October 29th, just because the goal is to, for us at that meeting, is to approve the report and be able to release it soon after that. If not, we will have to meet in November, and I have already scheduled a room in the Capitol for November 18th, but we're hoping that we will be able to cancel that and not have to meet in November. And then as I go through the bullets in the outline, peer staff will be responsible for report production. That's the report cover, table of contents, will help with page numbers, again, editing. And then next is our letters from Dr. Buttress. And then I know the task force, if he would like Dr. Edney, the task force would like Dr. Edney to write a letter as he did last year, if he would like to do that. And then we have the list of task force members and advisors. I will put that together and send that out ahead of time before October 15th so everyone can verify their information. We also want to make sure that we include people that have participated in the work groups. We've had a lot of experts helping in the individual groups, and we just want to make sure that we put their information in as well. So I will send that out to make sure we get that correct. So the next section is the acknowledgements and appreciation. And this was in the report last year, but because we're wanting to make it much shorter this year, I would think this section would need to be very brief and not as specific as it was last year. And then we have the introduction section, which for the most part, peer staff will be helping with this. It's the authority, purpose, methods, and then a summary of the previous report. And it has come up that do we want to include a summary of the previous report, or do we just want to refer to a link? So that was one question that I had. Do we just want to put a link of the report, of last year's report, in this report, or do we actually want to discuss in more detail, give a brief overview of early intervention and a brief summary of the findings and issues? And from the lead advisors and chairs and Dr. Buttress, I've had different feedback on this. So I'm happy if the task force kind of wants to let me know their preference on that. And if we do include a summary, I think we would want to make it a page or a half a page. And then next, oh, go ahead.
Mary Claire, did you want feedback on that now or later?
I'd be happy to have feedback on it now. But I can also wait.
Dr. Fitz just also put in the box exactly what I was going to say. I think a link for sure, but no more than a half a page. To me, the biggest part is making sure the folks reading this understand first steps is 0 to 3. And that, you know, particularly as I'm going to guess that one of our recommendations will be funding moving forward. We want them to know this is a program that's not received millions upon millions of dollars in funding. And I think it's easy to get confused if they don't know 0 to 3 is the population we're targeting.
That sounds great. Does anyone else have any thoughts on it before I move to the recommendations part?
I think to just make sure that they know that we did ask last year. I think the link is great, but just to know that we've reconfigured something so that they might think, oh, I saw this last year, but that this is different than what we had originally done last year.
That's a great idea. A good point. So I will move on to the recommendations. We've taken this into 3 sections, and it will include a 1 to 2 page discussion and a portion of the chart that relates to each section. And the plan is to the chart as it is now, we're going to work on formatting and making it more readable and understandable for the reader. I know Dr. Hannah and I are going to try to brainstorm on how best to do that. But one question I did have, and maybe it's not a question for today, but maybe when we start writing, is should the chart come before each group's discussion, or should it come after? And I'm happy to talk about that now, or we can wait.
Mary Claire, this is my 2 cents. I kind of like it before because some people might just look at the chart and not even read, you know, it's kind of a shorthand. But that's just my thought.
And this is Susan. That's my thought too, that underneath the chart, there could be something labeled discussion and do further explanation then. But yeah, I think that's why I like the chart so much, is I think people who are in a hurry can glance and say, okay, that makes sense, and then move forward.
Well, I'm glad y'all brought that up because I was thinking of it after, but I think it does make sense after hearing your points that maybe putting it first would be helpful, especially if people may not read the actual discussion. And then the three sections are general.
I just had a question for point of clarification. You're doing a summary first, right? And then you're talking about layering behind the summary.
We're talking about on the sections on this graph that we have with all the points, they'll be separated out.
Right.
We'll have each section with the points in the table form and then underneath the discussion. But at the beginning, we will have an intro that talks about, yes.
There'll be a summary.
I was making sure because the bullet says summary of previous report. So you're going to have the previous under introductions on your outline. You've got authority, purpose, methods, and procedures, summary of previous report. And then you go into recommendations, but the recommendations are from the new report, right?
Right, that is correct.
So where are you going to introduce the new report before? Because I would not want one to think that this was the recommendations from the old report because it looks like it's following that.
We will add, I can add in a bullet before recommendations to give like a brief summary of what we're about to discuss. So that's a really good point.
Very good.
So then we have the three sections. The first one is the general operations and management of the First Steps program. And this is things that can be done with or without changing the model or billing and reimbursements. And this section will be where health, who has already done a whole lot of improvement on the program, it will be highlighted in this section, I believe. And this is going to be written by the training and quality control groups. And then the next section is the implementation and service delivery model. This is the proposed delivery model and how it will address issues and improve the program. And this is written by the delivery model work group. And then we have the billing and reimbursement model, which will be written by the billing work group. And following that, there will be a conclusion and summary of the recommendations for health, hubs, and the legislature. And I'm kind of thinking like sort of like what we did last year, there would just be kind of a small conclusion here. And then we could attach a summary of the report recommendations that could be included with the report. I know health has both the report and the summary currently on their website. So it would be something similar this year as well. And then the last thing on the outline are the appendices. I'm not going to talk about each one of those because I feel like a lot of it may change once we start writing. So I'm going to leave that alone, but they are here if you would like to look at some ideas that the group has had for the appendices. And then that's pretty much all I have for the outline. I did want to say that peer staff is happy to help and support the task force with whatever they need as they're writing this report.
I want to make just a couple of, well, first of all, does anybody have any questions about that? About the outline?
Dr. Buttress, I have a quick comment, and that is each work group will essentially turn in 3 things to Mary Claire. One is your content for the chart. The second is your section that you write for in the final report outline. And then the third, the recommendations are very high level, but any technical detail guidance that you have for the Department of Health will go into the appendices. So you can provide that as well. So it's really 3 things. Sorry.
Okay. Any questions about that at all?
I see in the chat that Dr. Stratton-Gacke said that maybe the summary of the previous report could be moved to after the acknowledgements to avoid any confusion. And I think I like that idea. We can move it and then go into the introduction of this report that we're talking about.
That sounds good, yeah. Thank you for that. Any other suggestions on moving things about or changes? On a sort of light note, we were discussing how successful the pre-K collaboratives have been. And even though I know that's housed in the education system and a bit different as you get older kids, we're in the very rapid brain growth arena of the birth to 3 child. So it's really not an education model alone, it's education and health together. And that's why it's housed in the health department in our state. But there's been a lot of confusion about the terminology that we've used with hybrid model or hub model or whatever. And I don't know who gets credit for this, but somebody said, what if we call them the different group, the sections, early intervention collaboratives? And I wanted to throw that out. Do we want to consider that terminology at all, just to start introducing that idea? I thought it sounded good, early intervention collaboratives. What do y'all
This is
think? Health
Casey.
department?
Never turned my mic off, so I'm glad I haven't said anything, but I love, love, love that. And actually OSEP has recommended that we move away from the terminology hub because it doesn't necessarily convey that collaborative effort.
Oh. So we were in the right direction and didn't know it. Okay. Well, does anyone have a problem with us trying to adopt that as we're writing this? Again, we know that whatever we do, it's not going to be all of the sudden. The pre-K collaboratives have been a gradual build over the years, and I think we all envision, we're hoping that this is a 5-year build. It may take longer than that, but to really hope that we could get these kind of services all over the state within 5 years would be wonderful. But again, as everyone knows who's read about the pre-K collaboratives, the standards are high. And there is insistence on high standards be maintained. And I believe that's why the results have been so beautiful. And we thank the legislature for funding it. And the legislature has funded that very well to the tune of about 144 million, I think. And so if not suggesting that we need that much, but because there is a billing model that we're folding in, but to hopefully perform as well as they have.
Dr. Hannah has a follow-up question about that. So are we calling the hybrid model the hub's relationship with MSDH collaboratives? Is that correct? Is it MSDH hub collaboratives?
Or take out hub and say, take out hub altogether is what OSEP had asked.
This is Casey, and I love it. But a part of me is fearful that folks who are confused in voting will think they've given all this money to pre-K collaboratives. Are they the same thing?
And that was, thank you for that, because that was some misinformation that we found out about a few years ago as we were speaking. So I guess I turn to our senator and representative who are here and online. Do y'all have a comment about that? Can you turn your mic on, please, sir?
if you're asking me, if we can only get rid of this state income tax, then all of these problems will be solved. And I think that's what we're putting all our effort into, is getting rid of the income tax, because then we'll have this enormous growth and there'll be everything for everybody.
And I think as long as the collaborative is defined, early intervention or pre-K, there should not be any confusion. I think if it's clearly defined what we're speaking about, would be my thoughts. And I think Senator Boyd was going to come in. I'm sorry, Nicole.
No. So I agree with Senator Robinson. I think, and I do like, I love the terminology because that is what it is. I think the legislature really has a great understanding of how collaboratives work. So I think this especially works in comparing it to that. And I think an EI collaborative actually makes a lot of sense for legislators because you're starting with that, the very earliest age, and then they will move to the preschool collaborative. So I really like the terminology, and I think it actually clears up and really helps clarify to legislators what this is. So great job, whoever came up with that.
I know, I don't know who needs to take credit. Who was that? Huh? Oh, it was Sarah Myers. Sarah, thank you for that. Okay. Okay, so yeah, probably somewhere at the beginning, we ought to say something about birth to 3 early intervention collaboratives. And then as we move through, we don't have to go through all those words, but to make sure at the beginning, and maybe I can intro that too at the beginning. And my forward just sort of latch on to the fact that we've been so incredibly successful with the model for pre-K collaboratives. Okay, any other general comments? Doesn't have to be about that, but anything else?
I have a question. This is my first year on this, and so I just wondered, once we finish the document, and y'all send it to the legislature, is anything else done beyond that, or does anybody present it to anybody, or is there anything that happens after we pass the document off?
That's a great question. I know that I had some interviews, we publicized it, but I would again turn to our legislators and ask them, what is our next best direction? Because we want to make sure that we didn't just write a report that then gets neatly folded up and put away. We want to make sure that this is followed through. We did, by the way, in our recommendations, we are trying to navigate through then what, how do we assist? Because we've got a lot of knowledgeable people on this task force. How do we assist the health department in moving forward and helping them? There was some discussion about the State Interagency Coordinating Council, ICC, being part of that, and instead of creating another group to help with that. And this might be a good time to talk a little bit about that very thing. But before we talk about ICC, can we ask our senators and representatives about what they think our next step as far as perhaps presenting it, talking to subcommittees or whatever?
Dr. Buttress, you will be receiving an invitation, and if you can't come, one of the members of this committee will be asking y'all to present to the special task force, which this original legislation came from that task force. back to the task force and women, children's and families, which Senator Bryan and Senator Robinson are a part of as well. And we'll have y'all present that in November. And then I believe our next steps are, trying to work with our appropriations team and the Department of Health in trying to procure resources for this, of which we all want y'all to be a part of, encouraging your fellow legislators in your areas to make sure that we appropriate monies towards this very important issue. So that's kind of our next steps in the process that we'll be kind of going forth with.
Thank you, Senator Boyd. Any other questions about that? It was a good question. Okay, well, I think, it would be nice if we could break up into subgroups, but that is clearly not possible. We have 15 minutes more if anyone has a topic or a question, or if any of the subgroup leads want to make any announcements about perhaps your next step.
I think for us, our next step will just be breaking down our writing section and asking for help on that.
So no dates set yet. Is the plan basically for you guys to do that via email? I guess that's probably the most efficient way. Yes, I see some nods. So, okay. So Mary Claire, any further direction from you?
I guess just get with your work group chairs and leaders, and it's up to all of you how you want to go about filling in the information. I know some people have talked about a Google Doc. We also have a SharePoint if we need to set something up, but that is up to the groups. However, whatever works best for all of you, and you can email me, call me, whatever you need as you're writing, and however we can help.
And I'll be
October 15th.
October 15th is the deadline, she says again. And I'm happy to review and help with any work group. I'll be working on my couple of portions also. And as Mary Claire mentioned, remember that they are so very helpful. And if you can't find some information you need, or need to pull something out from somewhere, just let them know and they'll be glad to help. If there are no other questions or comments, I can give you back 15 minutes of your day, and I will entertain a motion to adjourn. Senator Robinson's moved for adjournment. Do we have a second? Nobody's going to second it?
Dr. Fitz, I'll second, if you can hear me.
We got it. Good, seconded. Okay, the meeting's adjourned. Thank you so much, everyone. We appreciate you.